Sleepwell was my first suggestion for him that, if you have someone come in and they're wanting to learn more about sleep, it's sort of a one-stop shop. I'm Dr. Katherine Fretz. I'm a registered psychologist in Vancouver, BC. I work in a medical setting in a hospital, and I also am doing my postdoctoral fellowship in insomnia research. And Sleepwell is one of my first go-tos for any sort of health professional who wants to learn a little bit more about sleep, learn a little bit more about first-line treatment of insomnia. So it is something that I will share a lot with other professionals. And when I'm working with clients directly on sleep, it is one of the tools that I will give to them sort of above and beyond what we will be able to cover in session if they have particular questions, especially about sedative hypnotics and deprescribing, given that that is not in my scope of practice. It makes me feel like I'm doing something to sort of point them in that direction, as opposed to feeling sort of helpless. And that also allows us to stay within our scope because we're not making any recommendations. All we're saying, hey, there is some good evidence-based information available on this website. I invite you to take a look and speak to a prescriber. And my understanding is many of those family doctors, nurse practitioners, pharmacists are really grateful to learn this information and have some concrete tools that they can work with as well. I was actually speaking to a physiotherapist. They're having a lot of patients come in with chronic pain, and sleep is a big issue for a lot of these folks. And so Sleepwell was my first suggestion for him. That's sort of a one-stop shop for people to be able to learn a little bit more about what treatment options might be available and some resources. And this person was so incredibly thankful, and it was just a really wonderful opportunity to kind of see the potential ripple effect of just having more people knowledgeable about insomnia and ways to treat it. Sleepwell and the different resources that it will provide in terms of books or online programs, different tools that they can use, like sleep diary, that they can use themselves to manage their insomnia on their own. I really, really like it for that. Having an actual handout, actual tools on gradual dose reduction is so helpful for them. It gives them this very concrete plan, builds up their confidence instead of this sort of nebulous, probably scary idea of tapering off your medications. I find having a tool like this available and to have primary care providers know about this, I think has been one of the biggest sort of shifts that I've noticed when people sort of talk about their practice and the way that it's changed as a result. It's really quite interesting just how having access to evidence-based information in a really easy to digest, free way can really make a big difference.